It is so important to find time to reflect at the moment, and I know how difficult it can be to find that time. But we are here with this opportunity to gather together and remember, pay our respects to those we have lost, and support one another. I am pleased that you have been able to join us today. We are here on the 11th of March to mark a year since the World Health Organization declared a global pandemic. A year since COVID-19 entered the public consciousness and impacted on us in ways we couldn't have imagined. And not just for a month or two, but for over a year now, you have been working under immense pressure. This is an unprecedented challenge, unlike anything our generation have worked through before. And I've heard from you about the toll it has taken on each and every one of you, both personally and professionally. Many of you feel exhausted and anxious because of what you've been working through. The relentless pressure, that is unsustainable. You've worked on the front line throughout the pandemic at enormous personal risk. And sadly, too many of our colleagues have paid the ultimate price and lost their lives. I want you to know that I hear your anxieties and concerns, and I carry them with me. Many of you have said you want to leave nursing, a profession you love, because you feel overworked, underpaid, and undervalued. It is a terrible position to find yourself in, but you carry on. And you carry on because of your dedication to nursing, to your colleagues, and to those you care for. I've always been proud to be a nurse, but I have never felt more pride in our profession than this year and last year. We have been pushed to the limit, but COVID-19 has brought out the best in us. We have worked together as a team, working with a common goal and going above and beyond. And it has demonstrated to those outside of nursing what it means to work in our profession. Our dedication to patient care, how we lead teams, make complex decisions to diagnose and treat patients. Our work in research, innovation, influence in practice. How nursing is fundamental to patient safety. And the power of the voice of nursing. We have led the COVID-19 response, and we continue to lead through the vaccination programme as it is being rolled out. Whether we've been working directly in the front line with COVID-19 positive patients, or whether we continue to deliver health and care services in communities or care homes across the country, nursing staff in every setting and every role in every corner of the UK have played a leading role in the response to this pandemic. We have spoken truth to power every day when we advocate for our patients and when we speak about our experience in the workplace. And we will continue to lead because this is what nursing is and does. As health and care service leaders start to think about the return to normal service after COVID-19, we will make sure that the nursing voice is heard and is leading those discussions. We are here today to reflect on the year past, but also to come together and reflect on the tragic loss of colleagues to COVID-19. And every week we hear the news that more healthcare workers have lost their lives. Every single death recorded during the pandemic is a sad loss for a family or a friend, but it is a tragedy when someone has died caring for others. Nursing support workers, nurses, midwives, nursing students, or our healthcare workers from other professions. I know I speak for us all here today when I say our thoughts are with the families and friends of every single member of the nursing community who have lost their lives during this pandemic. We will hold a minute's silence at 11 o'clock to remember those we have lost, reflect on the past year, and consider the immense contribution we have made.
So I've just got in from work and I'm actually really tired. That was a really long day. But I'm glad that I've been in and kind of seen for myself what's happening. And it was calming in a way. It was kind of nice to be away from the hysteria that's going on in the world at the minute and people kind of stockpiling for an apocalypse. When in work, we're just kind of getting on with it and kind of gritting our teeth and being calm. Maybe it is the calm before the storm and we know what's coming, but I felt that it was more sensible area in work and the people are being a little bit more sensible. People are still frightened and I understand that, but I feel a little bit more calm than I did this morning. I've had a really tough day today. I had a patient who came in with a broken hip and with symptoms of COVID-19 and an elderly lady who was in lots of pain and quite hard of hearing and her eyesight's really poor. So she must have been really frightened seeing me in a gown and a mask kind of coming towards her. Obviously visiting hours are restricted so that we can limit the amount of people coming into the hospital and I totally appreciate that. But I just really felt for this little old lady. She was really frightened and I just wanted to squeeze her. Which probably wouldn't have been appreciated because she got a broken hip. So yesterday I made the decision to move out of my house with my mum and dad and sister and my son in order to keep them safe. So I have spent the morning unpacking at my other sister's house, who is also a nurse. So we will be living together for the foreseeable future. And I have left my family behind so that they can be safe and away from infection. And I am utterly heartbroken. Remember with the Australian bushfires when you were waiting and watching on the news and social media and you're waiting for those kind of clouds and the fire to come, but there's nothing you can do apart from sit and wait and watch it happen. That's kind of how I feel at the minute. This is going to hit. It's going to be really scary and we're going to be really, really busy with lots of poorly people and there's nothing that we can do to kind of stop it at the minute. We're just waiting and it's really weird. It's a bit frightening, really.
I'm so proud of everything our profession has done this year. How nursing staff have stepped up to the mark, making superhuman efforts to make this incredible pandemic something that we have been challenged by, but which we will not be defeated by. The nursing response to COVID-19 has demonstrated, above all, the exquisite skill, expertise, and complexity of the knowledge that our profession deploys in everyday decision-making. It has made nursing visible as never before to politicians and the public, giving them new insights into what nursing staff have to contend with and do every day. Our profession is familiar with managing and often excelling and exceeding expectations, even our own, in a crisis. We lead from the front in situations of challenge and difficulty. We troubleshoot, we problem solve, we find ways to get treatment to patients and deliver care as effectively as possible. Nursing staff have demonstrated, above all, they are leaders as well as partners and practitioners in healthcare. And this has been clear for all to see. And it's never more forcibly expressed or represented than in a pandemic. Strangely, Spanish flu, SARS, MERS, Ebola, the early days of HIV, bring out the best in our profession. Why? Because often these are periods of great uncertainty, panic, fear, anxiety, all meld into one, because we just don't know often what it is that we're actually confronting. And that's the moment when, in the absence of effective therapeutics, what do we have to fall back on? We fall back on the very fundamentals of nursing care, because that is what gets patients through. What we're seeing from research is just how innovative you've been, how creative you have been in choreographing new ways of delivering and managing and organising care. New ways of communicating and forging those links virtually between patients and their loved ones when they can't visit. When you can't feel that human touch from those you love around you, especially at your hour of need. We've been trying to find these different ways to help people talk, to help people connect, and sometimes say their last words to their loved ones. Nurses have been at the forefront of developing these technologies under the most adverse and pressured of circumstances. We've cared not just for patients and done this as equitably as possible, but also patients' loved ones. Everyone has been included, and now we're trying to switch on those services which have had to take a bit of a back seat, and we're ramping those up as we move into a different phase, we hope, of the pandemic itself. That is over and above rolling out and launching and supporting the largest global vaccination programme within the shortest, most compressed timeframe this world has ever seen. This is such a moment in our history. And you are leading from the front, doing all of this simultaneously. It is such an awesome and magnificent achievement. I have a sense of how difficult this year's been for you and for all members. And I just want to share my huge, huge thanks to you for all that you have done, and to do so from the bottom of my heart. Thank you for continuing to do all you do for patients and for our colleagues.
You have to relearn the levels of communication that you use. And I don't think you realise that how much of your non-verbal cues that you're looking at and how much we rely on facial expressions. And it's not until that's taken away from you that you realise how difficult that is, especially with my some of my mature patients who have difficulty hearing. They rely on looking at your mouth to interpret what you're saying. And then once you take that away, you've taken away a massive proportion of somebody's face and then ability to communicate. So finding that really difficult. But anyway, we just have to get on with it. It's the best way and it's the safest thing. But it's something that I kind of not really thought about before. And trying not to be terrifying to my little old lady in the bed as I come towards them looking like something out of ET. Anyway, we're all just doing our best, and that's what I think is coming across more and more, is that people are pulling together and trying our very best for our patients, which is what all of us ever wanted to do when we signed up for this anyway. So I am menopausal, and that means that when I am in work, I am roasting. And on orthopaedic wards, most of my patients are in pyjamas and having difficulties moving around. So we keep the ward nice and warm for them. So that's great. But it means if I'm having a hot flush, I am a mess. So I wear my hair up in work. I've got long hair, and I've been wearing it in space buns. And I kind of got laughed at, called Princess Leia and all that. Oh, well, no one's laughing now. Because my space buns, instead of hitting my ears with me face masks, I can hook it around my buns and it doesn't ruin my ears. So now everyone's coming in space buns now. Oh, last laughs on me, the mad menopausal woman. So that's been quite funny today, seeing everybody coming in with the funky new hairdos, all to save their ears. So we've had a bit of a giggle at that today. Woken up to the news this morning that a nurse in Liverpool has died. And there's just no words, is there? One of our nursing family has gone. That's really sad. My heart breaks for her family and friends and her colleagues. I don't know what to say, really. So sad, so awful. It's all creeping a lot closer to home. Oh, God bless her. Oh, God bless her. So I had a text this morning from my GP to tell me that I'm in a high-risk category and that I need to isolate for 12 weeks. And I knew that was coming, and I think, moving away from home, I knew I was going to keep them safe. And I've been trying to do my best in work and to do my best for my patients and my colleagues, my team. And now I don't know what to do. So, if it was anybody else, I'd be telling them absolutely go through your front door and stay there for 12 weeks and keep yourself safe. But I'm a nurse, and I need to be nursing my patients. I need to be with my team. But I also need to keep myself safe for my son and my family, so I'm really conflicted and I don't know what to do. I just feel a bit grim about everything, and I just want to go back to bed and hide under the duvet and wish that none of this was happening.
This year has been more of a challenge than any of us could ever have imagined. It's taken a huge toll on us, both personally and professionally. None of us have been unaffected by the pain of the last year, and almost all of us have lost friends, colleagues, and loved ones to this awful pandemic. And before reflecting on that, I wanted to assure you that the RCN is here for you through these tough times. The staff and the elected members are doing all that we can to support members and the wider nursing family. We've been working hard to provide you with the best evidence to support your practice and deliver vital professional resources to support your work with COVID and get the vaccination programme rolled out. We've been consistent in our demands for all of you to have access to credible and safe PPE, and we've supported your refusal to treat if you don't have access to the PPE you need. We've supported you during redeployments, and we've provided you with the tools and guidance on how to raise concerns with your employer. And we've raised concerns on your behalf at every level, with employers, with governments on a number of issues, including increasing patient to nurse ratios in intensive care units. And we've continued to lead work that's so important to you and our profession, such as pay and safe staffing in the NHS and in the independent sector. We've kept the impact of staffing shortages very high on the agenda and in the public through the media, and we've raised this specifically during the pandemic as the impact of nursing shortages has been so keenly felt. and we will continue to influence and lobby government through our UK Staffing for Safe and Effective Care campaign. It's been such a sad year for all of us. Each of us has now likely experienced the death of a patient, the death of a colleague, death of a friend, or the death of a loved one through COVID. And we feel each loss very deeply and very personally. We feel the collective loss of all those who've died because of the virus. Over 800 healthcare workers have died in the last year. And every single one of those deaths leaves a family broken, leaves a team shattered, and leaves loved ones and family members to their own individual grief. I can't really get my head around 800 deaths. It's just too big a number. And so I wanted to talk about one of my friends and a dear member of the RCN family who lost their life this year, Brian Wilson. Many of you will know Brian, particularly those of you who are active in Wales. But I first met Brian 38 years ago because, strangely enough, he was the father of one of my best friends at school. And I remember his surprise bumping into me at his my first RCN Congress. He'd been going for years. He didn't know I was going into nursing. And since then, I've been to 27 Congresses, and every Congress, one of the highlights for me would be catching up with Brian over a coffee or a glass of wine. He'd let me know how Bridget and Ian were doing, and we'd have a really good catch up. And as well as being a passionate advocate of nursing, and he was a very regular speaker at Congress, he was one of those really kind, gentle people who would help and support anyone who needed it. And many of his acts of kindness and support were done very, very quietly with no fanfare, and were only ever known to a handful of RCN members. But over the years, there were hundreds and hundreds of members who'd been helped and supported by Brian, often in very quiet ways. And for years, he'd been gently lobbying me about reintroducing lifetime membership for members, so that we could give free membership to people who've given a lifetime of service to the RCN. And when we voted this through at council only a few months ago, I was really looking forward to telling Brian in person at the next Congress. It was one of the things I was most looking forward to when we all finally get back together. And it's unbearably sad to know that I won't ever be able to do that. And we won't be able to share a laugh or a smile again. And I know there'll be times where it feels like we're struggling with the weight of all of this loss alone. And I wanted you to know that your council and everyone here at the RCN is behind you. Our staff are behind you. Our elected representatives are behind you. The whole RCN is behind you. And we're with you through this terrible, terrible crisis. And we'll continue to be your voice and support you through the difficult times ahead. And I'd like to finish by offering my own personal thanks to every single RCN member and every member of the nursing community for your resilience, for your commitment, for your continued support for each other, and particularly for the care that you're providing. I very much hope that you can find some support and some comfort in our event today. Thank you for joining us.
2020 was the most difficult year for nursing staff in so many ways, and these difficulties have continued into this year. None of us could have predicted the COVID-19 pandemic and everything that has come with it. As we know, in Northern Ireland, we had just embarked upon what should have been a more optimistic time following our historical strike action, but we could never have known what was to happen next. Instead of forging on with the development of safe nurse staffing legislation and looking forward to a better future for the health service, we found ourselves on the firing line for very different reasons. During March and April, much time was spent by the RCN trying to secure a safe level of PPE and priority COVID-19 testing for healthcare staff. We found ourselves having to demand things that should have been standard. We had to ask the government and employers to ensure that all nursing staff could care for their children without loss of income, and ask for clarity on the measures taken to protect pregnant and vulnerable staff. This was a very anxious time for you as members, and many of you have contacted us for support. I found myself actively raising these issues at every opportunity, which continued throughout the year. More recently, nursing staff have faced further difficulties through more severe nurse staff shortages as a result of staff having to self-isolate and contracting the virus. Redeployment has also been a major hurdle, and many of you have been working in unfamiliar areas, causing further stress for you. At various times throughout the pandemic, I've spoken to staff who have been very frightened and worried by the situations that they were facing. As difficult as this has been, it's a privilege for me to be in a position to do that. Because of the bravery shown by our nursing staff over the past year, they've gone over and beyond anything I could have ever imagined. As we all know, we are not out the other side yet, and we're still uncertain about how services will return to any sort of normality. One thing I am sure of is that nurses in Northern Ireland have led this fight over the past few years to improve safe and effective care for their patients, and they'll continue to do so. We will be demanding that safe nurse staffing legislation that we sacrificed so much to get happens, and that nurses are finally recognised through a decent pay award. Today, though, is a time to reflect on what we've all been through. We're going to hear from some of our members who have been working on the front line about their experience of COVID-19 and what it has meant for them. So many of you have experienced loss and witnessed unimaginable pain over the past year. We want you to know that you're not alone and that the work you do is truly valued. Today is a time to shine a light on nursing staff and to recognise all of you who are working day and night to care for your patients.
So as an ICU nurse, I'm responsible for at least 2 patients, and then I have a support nurse allocated to work with me. And then when the other ICU nurse goes on her break, I'm in a bay of 4, I'm responsible for 4 patients. And the PPE, sometimes I find my first time I go into the unit and put my PPE on for the day, I get very hot and I wear glasses, so my glasses steam up. And sometimes I feel like my mask is sliding off my face. And but I think as the day goes on, you kind of adjust to it, and then you get so preoccupied with everything you have to do, you kind of times you actually forget about it. Yeah. What happens is the doctor phones the families every morning to give them an update once they've done their rounds. And then often, they're having to withdraw on a patient, or if a patient's improving and they're able to talk to their family, we do Zoom calls. I think the most difficult Zoom call, obviously, would be one where the patient is deteriorating and they may have to withdraw. And listening to the family it's awful, and you feel terrible for them because they might not have seen their father or their mother in like 50, they've been in hospital for 54 days, and that point, and that you kind of know that they're never really going to see if their family member is going to die, they're never actually going to see them again or touch them or be able to hug them, and it's quite distressing. It kind of goes against everything we do as nurses, in the sense that normally if you knew that someone was dying, you would get the family in and you would make sure they have as much time with their relative as possible. And yet we can't facilitate that because of the issues with COVID and contamination.
This time last year, my role was really palliative care, lead nurse, so a lot of training and development of staff. So in the beginning of March last year, I was one of the first people within our community team that was redeployed. So initially I went to the staff testing pod and to the public testing pod in the Royal in Belfast. And then from that, after a few weeks, we then opened a community pod. So we were redeployed to that area. That was very quickly followed up by realising that staff needed training to go into district nursing and from school health and health visiting. So I was redeployed again back then to do training for staff so they could be redeployed. So I think redeployment has just been the word. I think that often the care home sector really have been forgotten about, and my experience there was, you know, the care that the staff were given, you know, they were doing the very best that they could. Their patients were so vulnerable, and once their COVID was in the unit, it was really, really difficult to try and reduce that down. You know, many patients with dementia, they didn't understand, they were moving around the unit. You know, it was a really difficult task for the care home sector. They had issues accessing PPE, which really was hugely detrimental for the staff and for the patients. They've also had a lot of issues, you know, with families. You know, families hadn't been able to access their loved ones. That was creating a lot of anxiety for families, which in turn was creating a lot of anxieties for the staff. You know, the staff see the residents as an extension of their own families. And when they were sick, when they were dying, when they couldn't see their loved ones, staff were finding this really difficult to deal with. It was really demoralising for them. And equally, a lot of staff members were shielding. They were becoming unwell themselves. They were pregnant and they couldn't go into work. And I mean, I saw staff sleeping in the unit, staying there at night in cots. I went into one unit one morning and the manager had just verified the death of 4 of her residents that had been there for many, many years, and that was one morning. You know, so the staff, you know, they had a very isolated experience. They had a very difficult experience.
When this all started, I was actually on annual leave, so I came back early, and really I think the worst thing at that stage was staff anxiety, the fear of the unknown, the apprehension. Staff just were afraid for them, for their families. We were probably one of the main groups that were still visiting people, us and domiciliary carers. We were sort of picking up other roles and maybe picking up just needs that were there that maybe necessarily we wouldn't have ordinarily addressed, like social care needs. And while our colleagues from social care were still in the office and we could report back to them, we just felt that we were the army out there and we were the only ones really that were actually really seeing patients. I think what I personally have found difficult is being away from my team and not being able to work as a team as we would normally work. We were always a very close-knit team that met every day, that a very sociable team that would have met outside work as well. And we had really close connections with each other. Over this past year, we're having to do that from a distance, where obviously the numbers are limited within your office space. Staff are feeling, I think, a lot more isolated. District nursing in itself is a lone worker, you know, is isolating enough without having this and not being able to meet up with your colleagues for a cup of coffee or for your lunch and discuss and debrief, basically, like nurses do. I think also too that staff are dealing with basically such a high turnover of palliative patients. It takes its toll psychologically, and having to leave one house to go to the next person who's on a syringe drive or who maybe has hours to live and leave that to go to another one, and, you know, possibly verifying a number of deaths in a day. It takes its toll. It definitely does take its toll. I just think that it has been a huge learning curve right through for us. There will be positives to take away from it. There will be lots and lots of learning. I think one thing we've learned is that we probably don't need half the meetings that we go to. And technology is wonderful that way. But I do feel that this is probably only the beginning of it for nurses, that nurses will be picking up both from patients and from the personal point of view, after been picking up the consequences and the results of this pandemic for years to come.
We knew that because it was COVID-19, it was going to be a respiratory pandemic, so we knew that the focus and the spotlight was going to be on the care that we were going to be able to deliver. And between the respiratory medics, the respiratory nursing team and all our respiratory AHPs, we were not going to be enough or sufficient to be able to deliver that care. Probably one of the major wobblers I had was one day when I began to think about the oxygen supply that we would have to the hospitals, because there was going to be a capacity issue in what you could actually deliver to the wards if the patients' needs were such that they were all getting high flow oxygen. And that was one of the days where the wheels came off my trolley, that you would actually have to ration oxygen supply to patients. Now, thankfully, that never happened. I remember one occasion, a lovely lady, she actually worked in the health service, so she was very familiar with healthcare professionals and the interaction of care. She got really distressing news when she was in, and she'd been days on CPAP, days and days, and she was improving. But she got really distressing news about her brother on a particular day, and she was inconsolable. And I was inconsolable seeing her, and as I approached her, she kept saying, "Anne-Marie, don't come near me, you can't touch me, you can't touch me." And she knew we were able to get her discharged from the ward, but she knew she couldn't attend his funeral. She was only going to be able to sit in a car and watch other people, attend the church. And just seeing that raw grief. I've been nursing 34 years, 35, and of course there have been sad and upsetting things that have happened throughout your career, but this and the separation of families and not being able to connect in the way that you normally can connect with people has been the biggest challenge of all, I think, for everybody, not just nurses, our medical teams and our AHPs, the domestic staff, everybody that's been involved. And then, no real time to debrief or step back, just that resilience to have to keep going, face the next day, support your team, make sure the team are safe and well and able to cope, and just that, keeping on. But I think we have seen nursing as a profession show real leadership, visible leadership every single day, every single shift on the ward. Again, we went into this pandemic and we were so short of nurses. And when you see some of the difficulties that have come across the system in terms of having a robust nursing staff for critical care, the right nurses with the right skills, we didn't have them at the outset. So the nurses that we had, more and more and more was asked of them. They were doing additional shifts. They weren't going home. They were staying until the job was done. It was only when somebody noticed that a colleague was getting particularly tired, or that, you kind of had to insist that they took a bit of time to themselves. But I've never seen anything like it. The bravery, particularly at the beginning when we didn't know what we were doing. They just put the PPE on. They learnt the skills. They looked for a bit of help or supervision when it was required, and they just got stuck into looking after their patients. And very often, I think, put family into second position because they were so focused on doing the job that they were trained there to do.
I would like to close with a few words to thank each and every one of you for everything you've done during this difficult time. As we have heard, nurses and nursing support staff have been leading from the front during this pandemic, and it is only thanks to the efforts of all of you that we've been able to keep our health services in hospitals, in our communities and the independent sector going. Patient care is at the heart of everything we do. While situations like this is what we have studied and trained for, nothing could have prepared us for the impact this pandemic has had on us, both personally and professionally. What we have lived through will impact upon all of us in the months and years to come. As a college, we're trying to support you with resources to help during this time, but the one thing I would encourage everyone to do is seek support when you need it, whether it be through work, through friends and family, or through the RCN. All of us have been touched by this virus. Some of us will have had it and been affected in different ways. Some of us will have lost loved ones, and sadly, there are healthcare staff who have also lost their lives. Today has been an opportunity for all of us to stop, think about what we have been through, and remember those it has affected most. A sincere thanks to all of you for everything you have done and continue to do.
We have now come to the end of our event. Thank you for joining us and taking time to reflect on the past 12 months. I would now like to invite you to join me in a minute's silence to remember the members of the nursing community we have lost to COVID-19. Thank you.